Did you know that colon cancer is the fourth leading cause of cancer-related deaths in the United States? Shockingly, over 100,000 new cases of colon cancer are diagnosed each year. This means that approximately 1 in 25 adults will face this potential threat in their lifetime. But what makes it particularly challenging is that colon cancer often remains silent, without apparent symptoms, until it reaches advanced stages. In this video, we'll delve into the early warning signs of colon cancer. Stick around until the end because we have a surprising early warning sign that you won't want to miss. It's a crucial sign that could make all the difference in your health journey. So, without further ado, let's get started. Number 1. Changes in bowel habits. One of the early signs of colon cancer symptoms is a change in bowel habits. This includes experiencing persistent diarrhea or constipation that lasts for more than a few days. If you notice a significant and unexplained change in your bowel movements, it's important to pay attention. Additionally, narrow stools, also known as pencil-thin stools, can be an indicator of a blockage in the colon. Feeling like your bowel hasn't completely emptied after a bowel movement is also a potential sign. If you often have a sense of incomplete evacuation despite having a bowel movement, it's worth further investigation. These changes in bowel habits can be caused by the presence of a tumor, which can obstruct or narrow the passage in the colon. It's important to note that bowel habit changes can also occur due to other factors, such as dietary changes or temporary digestive issues. Number 2. Blood in the stool. The presence of blood in the stool is another early sign of colon cancer symptoms. This can take the form of bright red blood on tissue paper after a bowel movement, or stools that appear dark and tarry. The medical term for blood in the stool is hematochezia, or bright red blood, or melena, or dark tarry stools. Blood in the stool can occur due to a variety of reasons, with colon cancer being one of them. In the case of colon cancer, the bleeding often originates from tumors or growth in the colon or rectum. However, blood in the stool can also be caused by other conditions such as hemorrhoids or anal fissures. Number 3. Abdominal pain. This pain is typically felt in the lower abdomen and may be described as sharp or cramp-like. While there can be various causes for abdominal pain, such as indigestion or gas, persistent and unexplained pain should not be ignored. In the case of colon cancer, the pain can occur due to the presence of tumors or the obstruction of the colon or rectum. The pain may worsen over time and can be accompanied by other symptoms, such as changes in bowel movements or unexplained weight loss. It's important to remember that abdominal pain can have numerous causes, ranging from minor issues to more serious conditions. Have you ever experienced unexplained abdominal pain? What steps did you take to identify the cause and seek effective management? Feel free to share any insights or personal stories. Number 4. Unexplained weight loss. Unexplained weight loss can be another early sign of colon cancer symptoms. If you're losing weight without intending to do so and can't attribute it to changes in your diet or physical activity, it's worth investigating further. In the case of colon cancer, tumors can cause a disruption in the digestive system, leading to a loss of appetite or difficulty eating. This can result in unintended weight loss over a relatively short period. While it's important to note that weight loss can be caused by various factors, including stress or hormonal changes, unexplained weight loss should not be taken lightly. Now, before we proceed to the next surprising early sign of colon cancer, like and subscribe to NATURALdocTV to stay updated. Number 5. Fatigue. Fatigue, or extreme tiredness, is a non-specific symptom that can occur due to various reasons, including a busy lifestyle, lack of sleep, or certain medical conditions. However, persistent and unexplained fatigue can be an early sign of colon cancer symptoms. In the case of colon cancer, fatigue can occur due to the body's response to the presence of cancer cells. Additionally, tumors can disrupt the absorption of nutrients, leading to anemia and subsequent fatigue. It's important to note that fatigue alone is unlikely to indicate colon cancer. Number 6. Iron deficiency anemia. Iron deficiency anemia can be another early sign of colon cancer symptoms. Anemia occurs when the body doesn't have enough red blood cells or hemoglobin to carry sufficient oxygen to the tissues. In the case of colon cancer, a tumor can lead to chronic bleeding, resulting in anemia. The loss of blood through the stool can gradually deplete iron stores in the body, leading to iron deficiency anemia. Symptoms of anemia include fatigue, weakness, palpitations, pale skin, and shortness of breath. Number 7. Changes in stool consistency. This includes persistently looser or firmer stools compared to your normal bowel movements. If you notice a significant or unexplained change in the consistency of your stools, it's worth paying attention. Persistent loose stools can occur if a tumor in the colon is obstructing the passage of stool, leading to partial liquid expulsion. On the other hand, persistent firmer stools can be a result of narrowing or constriction of the colon due to a tumor. It's important to remember that occasional changes in stool consistency or texture can be normal, as they can be influenced by diet or temporary disruptions in digestive function. Number 8. Bowel obstruction. In some cases, colon cancer can cause bowel obstruction. A bowel obstruction occurs when the colon is partially or completely blocked, preventing the normal passage of stool. Symptoms of a bowel obstruction can include abdominal pain, cramping, bloating, nausea, vomiting, and constipation. While a bowel obstruction can occur due to various reasons, including other gastrointestinal conditions, it's important not to overlook these symptoms. Number 9. Intestinal bleeding. While bleeding might not initially present itself as an early sign of colon cancer symptoms, chronic gastrointestinal bleeding could ultimately indicate colon cancer. It's important to watch for evidence of blood in your stool, even if it's not always readily visible. This includes dark blood, also known as occult blood, as well as bright red blood that you may notice on tissue paper after wiping. Sometimes small amounts of blood that can't be seen with the naked eye may only be detected through specific tests, such as fecal occult blood tests. Number 10. Frequent gas or bloating. Experiencing frequent gas or bloating can be a common sign of various gastrointestinal conditions, such as irritable bowel syndrome or indigestion. However, persistent and unexplained gas or bloating could be a sign of colon cancer, particularly if it's accompanied by other symptoms. In the case of colon cancer, tumors can obstruct the colon and interfere with normal digestion, leading to gas accumulation and bloating. If you notice persistent bloating or excessive gas that isn't relieved by dietary changes or over-the-counter remedies, it's advisable to seek medical attention. Please like and subscribe to NATURALdocTV for more health and wellness tips, including natural and homeopathic treatments. Also, let us know which of these signs are you most concerned about. If you have any questions or comments, please leave them in the comment section below, and we'll see you next time on NATURALdocTV.